Hello, I am Dr. Sathish, specialist pediatrician working in eye care clinic under Emirates Group of Hospital in Oasis Center. Today's topic is autism. Autism is not a disease, it is a spectrum of disorders. Autism spectrum disorder is a developmental disability defined by diagnostic criteria that include deficit in social interaction and communication and presence of restricted repetitive patterns of behavior, interest and activities that can persist throughout life. The word autism was coined first by Leo Kanner in 1943 when he presented paper about 11 children who were living in their own world. The prevalence of autism spectrum disorder is increasing globally. There are many possible explanations for this apparent increase, including improved awareness, expansion of diagnostic criteria, better diagnostic tools, and improved reporting. Now the prevalence is around 1 in 60 children. There are probably many factors that make a child more likely to have autism spectrum disorder, including environment and genetic factors. The exact cause is yet to be known. So there are so many theories. At birth, in the brain, the neurons are interconnected randomly. When the child grows, these interconnections are trimmed and a pruning takes place to orient different functions. This pruning is under the control of some genes. If this gene is defective, it will prevent the development of certain areas in the brain. In autism, the mirror neurons are mainly affected. These mirror neurons are responsible for empathy, imitation, and learning of social interaction and communication. Usually the other domains are not much affected in autism. So the cause of this defect can be genetic or epigenetic or some environmental factors like poisons or infections in utero. There is no point in thinking too much about the causes. Parents usually waste time by finding fault with each other. Every child develops in different paces. Normally babies start recognizing their mother and smile at them by 2 months of age. Will have good eye contact and reciprocity. By 4 to 6 months of age, they respond to their name being called. By 12 months, they start pointing at objects they desire. By 15 to 18 months of age, they show objects to parents and ask them to look at what they are looking. This is called a sort of sharing known as joint attention. By 16 months, they can at least speak one meaningful word, and by 2 years, minimum 10 words and started using phrases. By 3 years, they start speaking 3-word sentences. If your child is not meeting the development for age, discuss this with your doctor. If you wait, you risk losing valuable time at an age where your child has the best chance for improvement. Early detection and early intervention is important. Surveillance and screening are important. Primary care physicians can find out, detect any delay in the development and can refer these children for further evaluation like auditory or visual assessment. Screening tools like modified checklist for autism in toddlers are available from 18 months of age. Simple questionnaire can find out the children at risk for autism and start intervention at an early age. You have to differentiate the similar conditions like autism, like Fragile X syndrome, tuberous sclerosis, and uncontrolled seizures in Lennox-Gastaut syndromes. Once you suspect the condition, early intervention should be started. Did not go after wonder cure claimed by some quacks. Multidisciplinary approach is the best. Pediatrician should coordinate with other specialties like neurology, psychiatry, psychology, ophthalmology, ENT, and other therapies like occupational therapy, physiotherapy, speech language therapy, and behavioral therapy. The hindrance to therapy is the comorbidities like ADHD, seizure disorder, aggressive behavior, and sometimes schizophrenia. If any of them are present, treat them medically to get the good result for the therapy. One-to-one attention is needed during treatment. Participation of family is important. Parents should learn the therapy and they can do continuously at home. First and foremost is the eye contact. Poor eye contact can be improved by keeping the interested objects like sweets or dolls near the parent's eye and reward them only when the child look at parents' eyes. Always talk face to face with your child. Do not interfere child's talk for correcting them. Give commands in simple way, never in complex commands. Speech language therapy will help a lot. The exercise on tongue will improve the language and speech. Occupational therapy can enhance the quality of life by improving the activity of daily living. Behavior therapy based on applied behavioral analysis play a major role. 60 to 70% of autistic children will have intelligent disability. 10 to 30% will show excellence in some field. Some of them will show extraordinary brilliance in some field called savant syndrome. So, the inclusive education is best for them. Special education can be given if the child is seriously affected. Find out the area of excellence in each child and train them. Give them vocational training to make them self-sufficient. Poor personal hygiene is a major problem with autistic children. So take care of this and help them getting good health. Sympathetic groups are very helpful to fight against the stigma of autism from the society. World Autism Awareness Day is observed every year on April 2nd. This year it is observed as April is observed as Autistic Awareness Month. The theme for this year is Empower Women and Girls with Autism. Usually, more boys are affected than girls at a ratio of 1:4. But girls are most neglected in the society. So, try to bring these children into the mainstream. Thank you.